I need to just stop and ask myself, why am I treating this person the way that I would treat every other patient?
Why might clinicians be uncomfortable talking about race, and why would they be uncomfortable talking about its possible effects in medicine?
Bias, is there discrimination that could potentially be playing a role in the use of newer medications like DOACs in our patients?
Just a problem if you're Black. This is all of our problems, and all of us need to do things to address it.
Something is killing people, just like hypertension is, diabetes and obesity is. We as physicians should be able to think about that issue critically. Racist policies, racist systems are the reasons that Black individuals, like I mentioned earlier, are living in neighborhoods that are more densely populated. It's the reason that Black individuals are both the essential workers, or more likely rather to be essential workers in this moment, but also more likely to have faced unemployment, are food insecure. The reason that Black and brown individuals had poor access to healthcare in the first place. Because of our history of racism and discrimination, Black Americans tend to live in poorer neighborhoods, in neighborhoods that are segregated and thus have more housing instability, food insecurity, and lower education. And remembering that it's racism that leads to a lot of the disparities that we see. In the year 2000, a paper came out that showed that Black individuals presenting with long bone fractures were less likely to get pain medicine for that fracture compared to white individuals. A study that came out just in 2016 that showed that medical students still thought that Black individuals had lower or less sensory nerve endings or thicker skin than white individuals. But by calling it out and by being thoughtful about some of these structures that are in place, I think we can start to make differences slowly but surely. Listen to whether it's Black students, trainees, faculty.
Educate yourself, educate your children, vote, donate.
Labels matter and language matters.
I know that this can be a difficult conversation, but I challenge everyone to embrace that discomfort, to be challenged by it. I know that it's hard, but imagine sitting with discomfort versus, sitting in a jail cell or sitting under a bridge or sitting at a funeral because of the consequences of structural racism.